Hello, Jeando.
Hello, Kevin.
In the last couple of videos, we've been talking about the model that we use in the initial Alexander technique and the relationship between the model and experiments that you can do with the teacher or on your own self-practice. So, what's the relationship in your opinion, and how we do it in the work? What is the relationship between the model and the method? Which is more important? Is the all the talk about the model and the diagrams and stuff, is that more important than the actual doing the work of doing the movements? How do they relate to one another in a lesson? And how does the model change over time based on your experiments? And how do your experiments change over time based on the model that you're working with?
Yeah, exactly. It's a very well put question. Most people have an idea that the model is the method, that model and method are the same thing. I'm trying to present things in a different way, or I'm trying to convince people that it's not exactly the case. To prepare that demonstration, I started with, an excerpt from Alexander's books, again, because I think it's important sometimes to start with a definite presentation. And it's better when the presentation is done by Alexander. So I'm going to switch to show you the picture of the text. And so you will find that, it's from the last book of Alexander, The Universal Constant in Living, at the end of his teaching career. Well, not the end exactly, but it was 1942. He died in 1955. That's it. I gather my thoughts. And so there is a chapter about the report of the Physical Education Committee of the British Medical Association. That is, these doctors wanted to investigate what good could be derived from physical exercises. Okay? And what the doctors, Alexander takes an excerpt from that review and from that report, sorry, and that's what he says. What the doctors are saying is that each of these exercises practiced in the physical education is designed for the purpose of producing specific effects, which, taken together, bring about the desired physical development. And Alexander just add, just so. But the question is, when the members of the committee wrote this, what was the picture of desired physical development which they had before their eyes? And wherein does this differ from the conception of those whose methods they set out to examine? I can ask the same question every single time. When I start a lesson with one of my students or one pupil, the question is, the student is going to present himself with his way of disposing the different parts of the organism. I'm going to see the person standing, I'm going to see the person sitting, or going from standing to sitting or walking, and these lessons being filmed, I'm going to look at what is the habitual disposition of the parts, and from that, I'm trained to reason out which are the decisions of movement that the pupil is making. I'm not saying that the pupil is making this decision of movement consciously or fully consciously. No, most of the time it's just this disposition is just the result of habits. And so, fine, my job is to teach that student to change the relativity of the disposition of the parts. And Alexander, I take a second excerpt from the same book, where Alexander explains how the student is going to progress in his lessons. He say by steps, more or less slow. So remember, there were different exercises taken together, which would bring something, a new organization of the parts. And he said by step more or less slow, it reminds us of the different exercises or different steps, according to the difficulties that the student is having to be overcome. The pupil passes from stages of preventing the repetition of the wrong employment of the primary control of the general use in such acts as sitting and standing, to gaining those new experiences of use in which the proper relativity of the parts concerned is brought about. So yeah, Alexander is clearly stating that there is an improper and a proper relativity of the disposition of the parts. He says relativity of the parts, but I think what he means is the relativity of the disposition of the parts. The relativity of the parts is if you have a dead body, there is a relativity of the parts, but if you have a live human being, you will find that there are decisions made by that person to dispose the part, to place the parts in particular relationship with one another. And so, fine. So Alexander is saying that the student will learn to prevent the wrong employment of the primary control. That is wrong decision that are leading to incorrect disposition of the parts relatively to one another. Well, fine, we know what's wrong, but how are you going to explain? Are you, well, it could be just that the teacher knows what is the correct disposition of the parts, and he will just condition the student to accept this knowledge as true without exposing the knowledge. Going to the student is just submissive and inhibiting any reaction, being a good boy and being molded into the correct disposition. And his task is to prevent the repetition of the wrong employment of the disposition. Well, it's very difficult to imagine that this could be teaching conscious guidance and control. Conscious guidance and control has to be something different. So comes the need of having some sort of reasoning so that the student can participate and can start to, understand what is going on. And so I take another example, but then from the very beginning of Alexander writing experience, this is from the Man Superior Inheritance, and he says, I'm coming back to a simple case where we are discussing the improvement in the abdominal conditions. And Alexander, to make it very clear, talks about the improved position of the abdominal viscera and the development of the abdominal muscles. One thing is for sure is that the improved position of the abdominal viscera is not independent of the position of the pelvis and of the position of the rib cage, obviously. And so this improvement in the abdominal condition is proportional to that of the respiratory movements. Some people think that Alexander started as a breathing teacher and became later a specialist of coordination. I don't think so. I think from the start, it's absolutely clear that Alexander is showing that, how much you place the abdomen in front of the head is important for respiratory purposes. So the readjustment of, the relationship between the parts is not different from the concern of the breathing teacher. And so he says that proportionality between the respiratory movements and, well, the placement of the abdomen is a fact that can be readily understood by the student when I point out that the movements of the parts are interdependent. That's a fundamental sentence. The movements of the different parts are interdependent. In our students, we will see that the movement of the rib cage and the movement of the pelvis and the movement of the arms are not random, are not separated, isolated one from the other. They are working more or less together. That is, it's impossible to move the rib cage without moving the pelvis and the arms. Or, conversely, well, you can try and move the arm, but if you film, you will suddenly discover that when you move the arm in space, your rib cage does adjust and your pelvis does adjust. And so Alexander comes and starts talking about the faulty distension of the splanchnic area. We have already seen that together, but for the one that haven't seen, the episode when I was talking about it, the splanchnic area is a very strange old word that Alexander is using because he doesn't want to use another one that is the epigastric region or the epigastric triangle or sometimes the epigastric bulge. And so what splanchnic means is the region of the stomach. And the region of the stomach is what Alexander sometimes called the protruding abdomen. That is a fault of coordination of movements that result in a faulty disposition. So he says, when the faulty distension of the splanchnic area is present, it will be found that the diaphragm is unduly low in breathing. And when there is excessive depression of the diaphragm in respiration, there is interference with the center of gravity by displacement forward and a compensatory arching backward in the lumbar region. I understand that for the moment this may not be absolutely clear, but you will see in a second that it will, because I've got some examples, I've got some images in front of my eyes. Well, I'm saying this because Alexander said, what image have you in front of your eyes when you want to evaluate whether different exercises are going to produce specific effects, which are going to combine to produce the desired result? And so, again, something we've already seen together, another picture, and that is even earlier in the introduction to a new method of respiratory vocal reeducation, that 1906, even earlier. At the outset of respiratory reeducation, Alexander was teaching respiratory reeducation. One has to contend with a mechanism which has not been consciously controlled. Well, the student is not in capacity of controlling consciously what he's doing with the rib cage, with the pelvis, and with the arms. Hence, he has no control over what he does with the splanchnic area, with the region of the stomach. And that what he does with it is also, obviously, in relation with what he does with the pelvis and rib cage. It's the relative position of the parts that we are talking about. And he says, in order to bring the student to consciously control the mechanism, this can only be met by using indirect means through the agency of ordinary volition. I'm always coming back to that sentence because some students are still asking questions about it. What do we mean by using indirect means through the agency of ordinary volition? We could say that we want to make decisions about a new disposition of the parts relatively to one another, and that is going to be done through the agency of ordinary volition, that is will. That is, I make a decision, but it's not sufficient. I have to obey the decision. And it's possible because these decisions are relative to movements of different different parts, and I can control the movement of different parts because there is a video recording of the moment. So if I say I am going to rotate the rib cage around an axis by giving consent to a movement forward with the upper torso and a movement back with the back, well, I can then look at the video recording of the session, of the experiment, to see if that has taken place or not. And the student is going to follow exactly the same method. That is, we create a strategy where there is a trajectory of the part, a timing, because there are different parts that need to move at the same time. And we are left to ourselves then in front of that camera filming us, and we don't see ourselves, and we decide, well, how can I move the lower rib cage back and the upper rib cage forward around an axis at the front of the torso? I have no idea. But you need just to experiment. Obviously, at first, it's going to be absolutely not what we expect, but we are going to learn from it. We are going to see which movements are occurring which should not occur. And these movements which should not occur when we want to rotate the rib cage in such a way as to reduce the protruding abdomen or the epigastric bulge, then we can make a second experiment and see how much discomfort we can accept that would, in fact, produce the necessary movements and make us see that we are going in the right direction. So Alexander talks about indirect means, and that's what he explains later. I'm reading again, the second paragraph is, for instance, it is quite useless to ask anyone to raise or depress the diaphragm, which is the consequence. But if he's asked to push out or draw in the pit of the stomach, that is, as he said earlier, the cause of the depression of the diaphragm. First, placing his hands on the part of the abdominal wall named, the mind has something to work upon, and this applies still more to other parts of the muscular system of the inspiratory mechanisms. So for many people that was so vague, they did not see the image in front of their eyes. So I am proposing a solution to that. I have found a picture. Well, that picture is already changed because I've added the lines and I've added arrows, but at first there was only this picture. It's in a book concerned with the direction of the respiratory mechanism. It's not a book by Alexander, it's a book by Jones about the bel canto singing, education. And what we see just an image. And we see an image of a person that is standing apparently in front of the door, and he's got a big book or a block, and is placing the block in between the door and the lower rib cage front. And we know because there is a caption and it says exercise 8, limiting the epigastric bulge, the splanchnic area Alexander is discussing. I suspect Alexander used the word splanchnic area or pit of the stomach also, because he doesn't want to use the epigastric term that is too tainted with the Delsart system. And so, when you look at this, well, it's very difficult to understand because you've only got the wrong organization of the parts. What would be the correct use of the primary control of the general use of the part? We need some sort of image in front of our eyes. The students need to know where he's supposed to go in order to change in the right direction. So I played, well, if he doesn't, there are a risk can be that the person may hallucinate or think he's got the correct directions of movements. I've got, for example, here, two different pictures placing two different teachers exactly in the same conditions. They are working, both of them, with a student, and the student is in front of our eyes. And we see that there is a student that has got the pit of the stomach that is really far back, and the rib cage, as we can see, is rotated in such a way that the stomach is not in front of the face. And we've got another student, another teacher. The student is just following the manipulation of the hands of the teacher, and we see that in this case, it's very different. We have a protruding pit of the stomach. And so, in the bell counter system, we see this picture. And I consider it's very difficult to know what is the solution to that. And so, from there, I will try to demonstrate reasoning and decision in relation to, in fact, create what the student needs. And so I imagine I'm working with that person. And the first thing I will notice and make the person notice is that when he's standing like this in front of the door, the lower abdomen, the lower rib cage and the pit of the stomach is closer to the door than the ear spot. You may ask yourself, why the ear spot? Well, there is a reason for that, or many reasons for that. The first one is obviously that the ear is an anatomical landmark that is characteristic, that you can't miss. The student will be able on his own to ask himself the question, when I'm standing or when I'm sitting or when I'm singing, because that's a singer, is it that the lower rib cage is in front of the ear all day or not? And when I make an effort, when I want to do something, what is the disposition of the ear relatively to the front of the lower rib cage, where the, armpit, where the, epigastric triangle is placed? That is, when you look at this sculpture, what you see, well, there are many spots on the sculpture, but there is something that is quite clear, is that the lower ribs on the front of the torso are, presented. They are just below the sternum. And this triangle between the sternum and the lowest ribs at the front of the torso, which are the extremity of the eighth rib, this is the epigastric triangle, and this is the epigastric bulge. Yeah, so what we see here, we must understand that this goes exactly with the description of Alexander, because when you get the lower rib cage so far forward of the ear, then obviously you must understand that the spine has to adapt, and the adaptation of the spine is that clearly here we have a shortened back. Yes, we have the unduly lifted front of the chest, and we have the, protruding abdomen. Alexander says that this is absolutely contrary to the best breathing conditions. Yes, but what is the correct image? And so the first thing is to debunk the idea of the head forward. There are different ways to get the head forward. If you're blocked by something so that you can't move the torso, you will see that you can move the head and neck independently of the torso. That's what I've made a collage so that you see what the person is doing. The head is going forward and down. So this cannot be the solution. This is going to collapse the airways even more. So any teacher of breathing would tell you this is no way that moving the head forward can help in anything. It's not possible to move it relatively to the neck, because if you go forward relatively to the neck, you go down. But if you go forward with the head and neck relatively to the upper rib cage, you go down as well. So it cannot be that. So we are starting, we have a necessity to use indirect means. An indirect means would be what Alexander called the poise of the chest. You must imagine inside the torso a solid object, the rib cage, yeah? And you must say to yourself, well, how could I create a movement of the ear forward on the vertical of the front of the lower rib cage where the bulge is, so that there is no bulge. And then you start to think, oh yes, Alexander is always talking about the poise of the chest. On this image, what we see, the front of the chest is lifted, back of the chest is dropped, and now the question is to find the proper reasoning and say, well, could it be possible to rotate the rib cage, lifting the back without dropping the front? This is a simple geometrical question. Most people, when they rotate, they have the idea that the center of rotation is going to be inside the line, inside the body. And if the center of the rotation is inside the body, obviously, it's like rotating any line or any stick. If you lift one side of the stick, it's going to rotate and drop at the front. So you need to reason out the disposition of the parts. You need to think, okay, do I want to collapse the front when I lift the back? No, it's not what we want. You need an image, a model of what you want. And that model is going to make you reason differently. You're going to say, wow, 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 if I don't want the front to go down, when the back is lifted, when the back is lengthening, well, it's necessary to imagine that I'm rotating an object on which I've drawn a line, and I'm going to say, I don't want to drop the front, I want to lift the back, hence, at the moment it's easy to reason out, the center of rotation has to be at the front of the line. And I'm going to explain this kind of reasoning to my students. I'm going to say to the students, you see, if you take a stick in your hands and you want to rotate it, most people will immediately choose a reasoning solution, which is to take the stick by the center and rotating around the center so that the back will lift and the front will drop. But then I said to the pupil, where do you need to place the, center of rotation if you don't want the front of the stick to go down? And at first, it's every time more or less the same reaction. The person is taken aback, and the person was not supposed to be on the grill like this, having to answer a reasonable question. And the person is a bit taken by surprise, taken aback. But after a while, I had this with a student just, I think this week or yesterday maybe, where the student started to move their hand and yes, started to hold the stick at the very front and to lift the back. And the stick was rotating around the front and therefore the front was not going down. And from there, if you want to understand what Alexander is talking by indirect means, there is even more indirect than this. You can ask the student to say, what if you wanted to lift the back and you didn't want to drop the front, but instead you wanted to lift the front less than the back? You can have a proportion of movement when you can ask a student to lift the back of the rib cage much more than he lifts the front. And then you ask the student, where is the center of rotation of a new motion where the whole stick is rotating with the conditions which are that the back is rotating faster than the front upward. And it will take a time for the student to realize that it's possible by a reasoning act to imagine that the front of the center of rotation is at the front of the torso, but outside of the torso. Why is it so important? Why am I get so excited? Because I'm saying that we can have a center rotation of the part that is outside of the torso. Well, the reason is simple, is that it's anti-somatic. You cannot feel a center of rotation outside the torso. you can only reason it out and conceive it. You can conceive that you can imagine a rotation where the rib cage is going up at the back much faster than at the front. And you must think, okay, I must imagine the center of rotation in front of me. Well, that's a bit exaggerated, but look, you could imagine the center of rotation against the door. And you could say, how would you rotate the whole upper torso relative to that spot? And most people would say, but that's crazy. Yeah, that's what experiments are about. At first, what we consider as possible for us, that something we can do or something we cannot do, well, depend mostly on our somatic experience, on what we feel, on our sensory appreciation. And sometimes it's necessary to just step aside from the somatic world and think, what if conscious guidance was possible? And then you start to discover that I've changed the image now. You can look at your screen again, and you will see that I've made a collage where, in fact, I have rotated the rib cage and the neck and the head relatively well to a point that is at the front of the rib cage. I show you, the exact image is this one. So I'm passing from one to the other, and you are seeing that what I have done, I have cut some part of the image, and I'm rotating the whole thing. And it's clear that there is a goal to that action, is that the ear is quite far from the front of the epigastric bulge, and now there is no more epigastric bulge because now we have the ear and the front of the lower rib cage on the same line. It's a kind of experiment, or you would call it procedure or exercise, that is not something, you're not to have to repeat that motion time and time again. No, you have to understand it. You have to understand where the center of rotation is placed, what part of the rib cage is going forward and what part of the rib cage is going back. For the moment, the action is facilitated by the fact that when the upper rib cage may move forward, if the pupil is capable of producing that new gesture, well, it's absolutely preventing the lower rib cage from going forward because it's blocked. And that is helping the student at first. Because the students, as we said, the movements are linked, and when the student tries to get the upper rib cage forward, most of the time, he just gets the lower rib cage forward as well. And this bel canto system was certainly made for, to help the student prevent the bulging of the epigastric region. And so that's the start. So we have some sort of exercise where there is one part of the region going forward. From there, we can extrapolate and say, oh dear, if you took the block away, could it be possible to perform the same action? Imagine a block. Imagine an inhibition of the movement of the lower rib cage forward. Or you could even imagine the back going back. Instead of just not going forward, you could even help it. Rotation is helped when, the top is going forward and the back is going back. But that is not the end of the story. We have also another thing to address, is that at the moment, bulge, the epigastric bulge, if you look at it, it's also very far forward of the knee and ankle. The lower rib cage front and the stomach region is forward of the ear, and it's also forward of course, the ankle. So you think, okay, wow, could there be not just this idea of getting the upper torso and the neck forward and up, but could I get also a lengthening of the back by having a combination where, in fact, you see a second rotation has been asked of the student, and instead of having the back of the belt up in the air and the front of the bell down, well, there is a link between the position of the rib cage, the position of the upper torso, and the position of the lower torso. So a rotation has been asked here. And so that is readjusting the pose of the chest, and this is readjusting the pose of the body. And the idea is to have the ideas all together. So you cannot have ideas all together. You have to have ideas one after the other. So you get the center of rotation and the part that have to move in order to perform these adjustments. And when it comes to the will, to the decisions, what we want to train your student to do is to decide to make this decision all together. So the concept and ideas are one after the other, but you need them all together in order to go in the direction of the model. So because this is a very technical and theoretical thing, I wanted to show you in the real world how it goes. So I present you a student. Well, he's a very new student. He's not an Alexander teacher. He had Alexander Technique lessons, but he's not an Alexander Technique teacher. And so you see him having his lesson, his film. So he's got a stick, a straight piece of furniture in his hand, and in the left hand. In the right hand, he's got a glass, because I'm asking him to prepare glass. And so I've added a few things. So I've added, a mask, of course, but also there is a spot on the top of the shoulder. Yes, I did not speak of the movement of the arm, but if you look at this picture and then at the last one, you will find that there is a change. The change is that the position of the arm and top of the shoulder is very, very close to the back. This man is pulling his shoulder blades backward close together. He's narrowing his back. On the last adjustment, he's not only getting the upper torso forward, the back, and of course the knees forward and away in order to get the lower torso organized, but also I have made a collage with the arm. I have drawn the arm very far forward, yeah, instead of having the shoulders totally back. As you can see now, the tip of the shoulder, the lower ribcage front, the front of the knees on the same vertical line, the famous line of unity. Yes, and so let's discuss now what we have. We have the top of the shoulder. It's going to tell us what more or less where the arm is placed. So there is a disposition of the arm relatively to the rib cage, and there is a disposition of the arm relatively to the epigastric bulge. And at the moment, we see that the epigastric bulge is forward of the top of the shoulder spot, it's forward of the heel, and it's forward of the knees and ankle. So we start with a clear representation of what we mean by epigastric bulge. We are going to see the lesson where we apply the principle of limiting the epigastric bulging. And so that limiting is not just directing the movement of the epigastric region. As you will see, the idea is the only way to solve that problem is to rotate the rib cage, rotate the pelvis, and also rotate the shoulder, and finally rotate the head. And you will see how this is going on in a session with a very, very new student. And so the student is starting to use the stick. He's not using a rectangle as in the picture, as when we started, we had this picture, it was a rectangle. Well, it's more or less the same idea. You have the stick is set against the door, and so we see that at the moment we are in the process of controlling what is the habitual disposition. The student doesn't know is pushing the epigastric bulge forward off the ankle, off the shoulder, off the ear all the time, of the pelvis all the time. He doesn't know that, and it's necessary for him to see a video recording where he's seen to do it, okay? But not only that, But my question is going to, it was too difficult to, for the person to ascertain where he thought the top of his shoulder blade was relative to the lower rib cage. So I took another, means, which is to generate a control of what is forward. Is it the tip of the elbow or is it the epigastric region? And after checking, the student started to realize that he was living with the lower ribcage front, where the epigastric is, always forward of the elbow. So we started to imagine an adjustment. I said to him, could it be possible to imagine two actions performed at the same time in 2 seconds in such a way that you would be seen with the tip of the elbow further forward than the lower ribcage front, than the epigastric bulge. Is that possible? And so the student had no idea whether it was possible or what, and so we started to see that kind of adjustment. The pupil is adjusting. Yeah. He's trying to get, of course, the elbow forward and the lower ribcage. Is that there are different effects. Something absolutely obvious is that the top of the rib cage and the neck and the head are going down. Okay, it's for me. You need to see this. You need to see that the first experiment is producing some desired effects. For example, there is something you can judge the curve of the back. Shortening the back is when you curve the back, and you can see that, yeah, there has been a lengthening at the back, yeah, but there is a collapse at the front. So it's obviously a step, but it's not it's nowhere near the model. Okay, what has happened is that, yes, the top of the shoulder blade has gone forward. We see, you can check the starting point and where it is now. And, well, but the neck has gone forward and down, and the head has gone forward and down. In our model, the head should not go forward and down. There should be a lengthening of the back, but the head should go forward and up. So at the moment, it's not working. Yeah? And that is clearly discussed with the student. It's not, oh dear, it's not going in the right direction. No, it's part of the system. The next effect is obviously to get more action on the lower rib cage. On this picture, you will see that the lower rib cage and the back are going back, yes? And we are trying to maintain the direction of the top of the shoulder blade of the elbow forward. So now we have an antagonistic, motions where you have one part of the rib cage going back and the other part resisting. Okay? And as you can see, there is a change in the disposition of the parts such that, well, it's clear that the back is lengthening more and there is much less dropping at the front. Remember that the pupil, that student or pupil is alone in his room, some thousands of kilometers away, but is making experiments, and these experiments are films, so he will see later what was the result of his response to these indirect means that were the instructions I was giving him. The instructions are obvious. He can write them down. They are repeated time and time again during the session, so there is no mystery. He's consciously directing, and he will consciously control what is affecting. And so the next step, of course, is to start to think, okay, now we've discussed the rotation of the rib cage relatively to the arm. What about the rotation of the pelvis relatively to the leg? And this is the next step. And we see that he's not only now, making the decision to move the lower rib cage back relatively to the elbow and relatively to the top of the shoulder blade, but he's also making the decision to move the top of the pelvis backward relatively both to the elbow and to the knee. And the person is changing his way of standing right up to the moment where you see we are starting to get that notion that it could be possible from the habitual way of standing, which is, sorry, this one is more or less accurate, and to the last of the session. So that gentleman is in fact performing experiments that are dictated by verbal orders, but these verbal orders are reasoned out in order to produce something that is very close to a model. A model where the ear, the top of the shoulder blade, the sternum, the lower ribcage front, the front of the pelvis, the knee, and the ankle are on the same vertical, where we see that suddenly we have the back very, very long from the lower sacrum right up to thoracic 7, and from there, well, the head is going forward and up. So, I wanted to show you all this so that you understand that I am not asking the student to perform a model. I'm asking the student to construct the reasoning block that lead to the model, and the model, the diagram of the resulting position and the attitude we are discussing at the moment is clearly set in model. Well, that is because Delsart was using these early classical Greek statues in order to, and we will see that the rib cage is rotated, the shoulders are very low, very wide apart, and the neck and head are very far forward and up relatively to the front of the lower rib cage, where the epigastric bulge is. We have a definite model. I have many more diagrams that I can show to the student so that the student will understand that he can compare the reasoning that led to the instructions to what the model in the end is. I hope that makes it clearer to you what the relationship is between the method and of course, the model. The model is not all. It's the reasoning that leads to the instructions that we have to devise in order to adjust to how the student is entering the room. How the students, what kind of linked movement the student has to start with? Well, there are many that are social, so that many of my students, they share the same more or less group of linked movement, improperly coordinated. But every student is a new case. You can't just apply a model. I'm not asking the student to apply the model. I'm asking the student to start to generate indirect means, understanding how they are created, how we reason out the disposition of the parts, how we reason out how to come from the habitual disposition of the part to a new disposition of the part. I hope this will help you. Any comment or question?
Yes, well, main observation is how much this technique is visual. The model, we tend to forget, like a model is visual. It's like a relational diagram. A model is how the parts relate to one another. And you need to see it. And then Alexander, that's the first thing he says in the first quote is, what's the picture they have in mind? So we would use the word model now, probably. That's what he means. And a lot of science is based on building pictures to represent reality, and then they explain the picture using words, which is what we're doing here also with the models and the method, and then the person has to follow the instructions in order to see if they can create the model. You used the word earlier, either non-somatic or anti-somatic. I forget which one you said.
I said both. I think I said both.
Well, that's because it's what, rather than sensing and feeling, what we're using here is seeing and reasoning. It's always useful to remember that's what we're doing here, because it makes a lot more sense when you actually go to do the experiments, because you're using a different part of your human self to command and to organize your movements. And then you go back to the video, then you check what happened, or the teacher will help you. And it's just very useful for people to remember that what we're doing, you're training yourself how to see first, and when you're showing the images there, you're helping the person see the model or possible models, and then you can't help but see possible experiments you can do now when you start reasoning about it in this way. So that's just the biggest takeaway I had from this. Um, so if anyone wants to have a lesson with Jeando, they can find underneath a link to his website, and you can learn about the model and the method and do some experiments with him on over Zoom. And we will see you in the next video. So thank you, Jeando.
Thank you, Kevin.